All attendees are in listen-only mode.
Hi everyone, good afternoon, and thank you for joining us. We'll be getting started with our Lunch and Learn Enhanced Communication for Practice Transformation in just about 1 or 2 minutes, so sit tight. Thank you.
Hello everyone, my name is Cheryl Fattibene. I'm the Chief Nurse Practitioner Officer at the NNCC, and on behalf of the National Nurse-Led Care Consortium and the AANP, I would like to welcome you to today's Lunch and Learn webinar, Enhanced Communication for Practice Transformation presentation, which I will present today along with my colleague Tiffanie Depew. Today's webinar is being recorded and will be available in the upcoming week on our Nurse Practitioner Support Alignment portal page, and a link to the recording will be sent to all registrants for today's webinar. All participants will be muted throughout the presentation, but I encourage you to submit questions during the course of the presentation. Please use the Questions tab on your GoToWebinar control panel, as seen here, to ask your question. It will be relayed to us, your presenters today, and answered at the end of the webinar. A survey will also pop up at the end of the webinar and will be sent in an email later today. Please take a few moments to complete the survey evaluating this activity, as your feedback is critical to the ongoing development and presentation of all of our webinars. The slides for today's webinar are available as a handout, which you can access via the Handouts pane as seen here in your control panel. You can click the name of the handout and it will be downloaded via your default web browser. The NNCC, or the National Nurse-Led Care Consortium, is a membership. Sorry, we're going to go back one slide. There we go. So next I'm going to turn it over to my colleague Joseph Reyes at the ANP to talk about how you can get free credit for today's presentation.
Hi, can you guys hear me?
Yes, we can hear you.
Okay, excellent. Hi guys, this is Joseph with the American Association of Nurse Practitioners. Today's webinar is accredited for continuing education credit by our education department. There are a couple of things that are required for a participant to receive CE credit today, mainly of which is how long you attend the presentation. We require at least 55 minutes of participation throughout the presentation for you to qualify for CE credit. We also require that you have access to the internet and you are viewing the slide deck in real time. So unfortunately, anybody who phones in today only will not qualify for CE credit. So if you've called in only, go and hang up the phone and try to find the webinar link, the original link that was sent to you by email when you registered, and click on the link and join the webinar so that you can view the slide deck, and then also call in so you can hear the presentation in real time as well. So for participants who do qualify for CE credit, you will receive an email from me after the webinar is complete, probably the next day. And in that email, I will lay out specific details on how to access your CE credit on our ANP continuing education portal page. And in that email, there's going to be a passcode, and that's something that you're going to utilize to gain access to the evaluation. And the evaluation is separate from the evaluation that you might receive directly after the webinar is over. This is an official AANP evaluation that will be required of you to complete in order to receive CE credit. And once you've completed those two things, you should have CE credit. Questions related to access to the CE Center or your ability to find the correct CE product, you can direct those to me at my email, jreyes@anp.org, and I'd be happy to help you to deal with those issues myself.
Thank you, Joseph. We appreciate that. So we're going to move on now to the presentation. So the NNCC, or the National Nurse-Led Care Consortium, is a membership organization supporting nurse-led practices and clinics across the country. Our mission is to advance nurse-led care through policy consultation and programs to reduce health disparities and to meet people's primary care and wellness needs. I wanted to take a moment also to talk about the national investment taking place for quality improvement in the U.S. with the help of our federal government and the organizations who are presenting this content as part of the Transforming Clinical Practice Initiative, which is sponsoring today's presentation. The Transforming Clinical Practice Initiative, or TCPI, is CMS's largest ever investment in practice transformation with an investment of over $700 million over 4 years and an enrollment of 150,000 plus providers across the country. The NNCC's partner in this initiative, the American Association of Nurse Practitioners, is the largest full-service national professional membership organization for NPs of all specialties. It is leading the way in advocacy, continuing education, and professional development for over 89,000 members. CMS funded the NNCC and the AANP to support enrollment of nurse practitioners into practice transformation networks, or PTNs, across the country, and to develop specific educational content that facilitates practice transformation in advance of upcoming payment reform changes with CMS. The NNCC and the AANP are the only nursing-focused grantee of the TCPI project. The AANP and NNCC agree that this initiative is important to ensure that all clinicians receive the support they need to remain competitive with payment reform underway. This initiative is an opportunity for healthcare providers to demonstrate to CMS and to the broader healthcare community that quality improvement is our yardstick to measure care, not quantity. So how do we prepare clinicians for the upcoming value-based reimbursement? We want to use this program to prepare all clinicians across the country for payment reform under MACRA, the Medicare Access and CHIP Reauthorization Act of 2015. Many of you have probably heard of MACRA. It's legislation that was passed to establish Medicare's Quality Payment Program, or the QPP. Under this Quality Payment Program, there are 2 payment adjustment mechanisms to incentivize quality tied to Medicare Part B payments: MIPS, or Merit-Based Incentive Plans, and advanced APMs, or Advanced Alternative Payment Models. Many clinicians will end up associated with MIPS, or the Merit-Based Incentive Plans. MIPS involves 4 elements that clinicians need to demonstrate successfully to maximize their Medicare Part B payments. These elements are quality, resource use, identifying clinical practice improvement or CQI activities that they are engaged in their practices, and the effective use of health IT. If you can demonstrate these 4 elements in your practice, you too can succeed in a value-based payment environment. I'd also like to make an announcement about MIPS for those that may be interested. So there will be a MIPS virtual group election starting on December 1st. And this information here is in the slide. I'll go through it briefly. As proposed in the 2018 Quality Payment Program rules, solo practitioners and groups can choose to participate in the Merit-Based Incentive Payment Program, or MIPS, as a virtual group for the 2018 performance period. Small clinical practices, including those in rural areas, may join virtual groups to combine their MIPS reporting. To form a virtual group for 2018, solo practitioners and groups would need to engage in an election process. The election period for that virtual group lasts from October 11th of this year through December 1st. If you are interested in learning more about this virtual group participation, we have provided information below, both with the YouTube link and also a contact link, and I would ask you to communicate directly via these 2 links to get additional information. So we are beginning our presentation now, and it's entitled Enhanced Communication for Practice Transformation. I wanted to thank everybody who joined today and to tell you a little bit about myself. So I'm a family nurse practitioner by training. I've been in practice for almost 30 years. I've worked as a primary care provider in FQHCs and other other community health settings, as well as for-profit healthcare and retail health. And I'm very pleased to be working in the National Nurse-Led Care Consortium now as a Chief NP Officer, working on this educational offering as well as many others that we bring out to clinicians across the country. I'd like to turn it over to Tiffanie Depew at this time.
Yeah, thanks, Cheryl. Hi, everyone. My name is Tiffanie Depew. I'm a project manager here at the National Nurse-Led Care Consortium. The work I do primarily lies in quality improvement initiatives for nurse practices, nurse-led practices, and patient-centered medical homes. Prior to coming to NNCC, a lot of my work lied in supporting continuous quality improvement for federally qualified health centers, both in Philadelphia as well as throughout New England. And I come to NNCC just with that clinical quality background. Thank you. So a quick disclaimer about today's presentation. The National Nurse-Led Care Consortium's training and technical assistance efforts are supported in part by the Health Resources and Services Administration, or HRSA, of the U.S. Department of Health and Human Services under a National Training and Technical Assistance Cooperative Agreement. So the information that you're about to hear today, its content and conclusions are those solely of the author and should not be considered the official position, policy of HRSA, HHS, or the U.S. government. Additionally, today's presentation was designed and developed in collaboration with our training partners at Arizona State University and as well as the National Center for Interprofessional Practice and Education at the University of Minnesota. We thank them for their partnership and collaboration in the development of this training. So just a quick, taking a quick moment, we want to set the stage for what Cheryl and I are going to be talking about this afternoon. So a quick overview of what we're going to be talking about today is, first, we want to be able to discuss the key role that communication plays in driving care teams. Next, we're going to be discussing the elements of SBAR, situation, background, assessment, and recommendation. Following that, we're going to have everyone go through an SBAR activity. And then lastly, we're going to close out today's presentation by talking about various steps that you can take to put SBAR into action within your practices, as well as recognize when SBAR is working. So some of the objectives that we want everyone to walk away with are to be able to identify outcomes of effective and ineffective team communication. We want you all to be able to demonstrate effective communication strategies. And lastly, we want you to be able to identify measures that you can take to evaluate team communication within your practice. So teams and teamwork in healthcare. So really effective teams require effective teamwork. Today's presentation is not only is based within literature and what research is telling us what leads to effective teamwork. So what is the literature saying? Well, in today's presentation, we're going to be focusing solely on the element of teamwork as it relates to communication. So when we're talking about communication or enhanced communication, what we're talking about are the outputs of care team huddles within a practice, utilizing universal communication styles, which research has shown leads to flattening hierarchies of care team members, which then in part leads to outcomes associated with improved staff and patient satisfaction and the elimination of duplication and documentation and improved overall accuracy of data and reporting. So you'll notice that a lot of these outcomes are in line with those of the triple and quadruple aim. So basically what Cheryl and I are going to be talking about is how you can use, how you can improve and streamline your communication style to enhance patient and staff satisfaction and improved patient safety and streamline workflows within your practice.
Next, we're going to talk about the effective communication and what really is effective communication. We do it every day, we know about it, but we really want to break it down for you into some smaller pieces and talk about what goes into good effective communication. So when we think about communication, we think about, you know, it's how we speak to one another, it's the words that we use, and in a way that hoping, you know, you need to be using the same language, both figuratively and literally, but also understanding differences that there might be. So you need to take all of that into consideration your audience, your message, before you begin the process of communication. The next piece in effective teamwork is really around leadership. So many of you are probably in leadership roles already where you're coaching, and if you're not, everyone should really be looking for opportunities to coach one another. If you find things that may not be working, it's an opportunity to coach people so that they can really do their best. I think we all want to do our best and sometimes don't recognize how to do that without some help from a coach. So, and in doing that, you're also showing your team that you're listening to them, you value the work that they do, and you want them to do better. You want them to be better. Again, this is a relationship. You make sure you go into with agreement on both sides, that the person is looking to be coached and that you have somebody that would be interested in coaching them. Next step is cooperation and motivation. You know, what brings people together? What are their desires for being part of the team in the first place? So obviously there needs to be that fundamental grounding of the whole team to provide that core cooperation that will make everyone successful. Cognition is another piece that we don't often think about in teamwork, but it's really important to cover that. It really is our shared thinking of one another. So do you know the roles of what others and what they do, and can they articulate what you do on a day-to-day basis? It's a good thing to do at a staff meeting or talk to people and just, you know, share your roles and maybe share what you think other people do, and you may find that it may not line up exactly with what you're thinking. So it's that ability to really recognize one another within the system and articulate the roles of others that will help you better understand how you can interface with them and really create that shared mental model that you need in order to be an effective team. And then, of course, the thing we all love and hate is conflict and conflict resolution. So looking at that within the framework of your team, how do you handle conflict? How do you handle disagreements? Do you need some tools or resources to help manage that? You know, there's kind of the low-level conflict, and there are the conflicts that can escalate up to HR, but that's really a place you don't want to get to. So it would be good to look at your team and analyze what you have in place right now for dealing with conflict resolution. And then lastly, the pieces of coordination is essential in teamwork. So team really means a group of people getting together to get things done, but we don't want that to be task work. So task work is really just getting a job done. Getting a person from point A to point B would be the task. But the teamwork is how you manage the life of your team with other people. So you really want to be focusing more on that than just on the individuals. Tiffanie had alluded to the triple aim, and want to just take a moment here to highlight the core principles from the Institute of Medicine Roundtable, and these resources will be and links will be shared at the end of the presentation. So the IOM has great evidence on high-performing team, and again, just to frame this in the context of the work we're doing today on this webinar, this is not just what we think and feel. All of it is it's baked into some very good work that's been done foundationally around team-based care and working together. So obviously, in order for there to be great teamwork, there's got to be shared goals. Again, we talked about the roles. There also needs to be a mutual trust. So people must trust one another. And working with that cognition piece where people actually understand what one another do is a great way of getting there and can lead to the effective communication that you need. Also need to look at ways to be able to measure your process and outcome in your communication, and we're going to talk about that a little bit more as we go further into the presentation today. So communicating effectively, and we're going to just dig a little deeper on this and go through a couple of examples. So again, just in light of talking about communication and really being foundational, obviously not only in our day-to-day, but also in the field of healthcare, clear, consistent communication is really essential. And good communication can lead to things such as patient satisfaction, provider satisfaction, as well as quality outcomes that we will see. When you have inconsistent communication or poor communication, there are gaps of care they happen more often, and probably the thing that all of us dread and fear in healthcare is medical error. So, and that's what happens when there is not good communication. Again, just going through that a little bit more, and what happens when we're not doing the best we can with communication is many people will decide to leave an organization even before saying anything to anybody about being unhappy. So that's why that communication is so key, because many people will vote with their feet and find other places to work. Projects may fail. Failed change management within the organization that you use, keep making the same mistakes over and over again when there's poor communication, and this is amongst the whole team. Most medical errors do occur during transfers, so a transfer, say, from a hospital setting to a long-term care facility, or from a long-term care facility to home. As we know, those transfers are when errors are most common and where we really have to be on the lookout. Malpractice claims also very high when there's communication issues and errors. And communication errors are also the 5th leading cause of death in the United States, which is, that number unfortunately has been rising over the years, I think, as we become more mechanized and we lose kind of the face-to-face warm handoff. So again, attributes of communication, kind of just to summarize this, how often to communicate is very important. So think about the frequency of your messaging. Too much can be overload. Too little, people will say they didn't know. Everything is about timing and being receptive to the message that you're communicating. So think about how and when you want to communicate important things that are going on. Communicating on the fly is usually never good. You want to have a time and a place, especially for important messages. And then the accuracy of the message. So make sure there's no gray area with what you're saying. And it's also better to focus on a singular issue when you're trying to communicate something. Don't bring up too many things at once. If you have one core issue, start with that, and then you can address some other issues underneath that. So again, just to review effective communication, and again, this can be used both at home and at work. Think about what you want to say before you actually say it. So that's kind of organizing your thoughts, maybe even jotting down some bullet points. Think about being concise. Language matters. Be careful of the words that you use. Always be respectful when you are communicating, and then make it in language that's easy to understand, and try to avoid jargon. I think in the healthcare fields we've disguised a lot of the work that we've done from the rest of the world by using jargon, and it's really need to get rid of that and just speak in plain English so everybody understands. So at this point we're going to talk a little bit about SBAR, and this is one of those communication tools that we do have in order to communicate in our workplace, and it works particularly well in a healthcare setting, but it can be used in many settings. Many of you may be familiar with SBAR, may have heard about it and retired it in your mind, as in not being easy to use, but we really want to try to bring that back today and walk through it and have you begin to think about it as an extremely useful tool for shared communication, particularly in a high stress, high volume, and a fast-paced environment such as healthcare. So as Tiffanie mentioned before, we're going to go through each of the pieces, and the first part of the SBAR is the situation. So this is really just a brief and focused description of what the problem or the need might be. And this is just facts. So if you think about it that way, so it's what is the problem, when did it start, how severe is it, and this piece of your delivery of the SBAR is going to be 1 to 3 sentences. So just think about that. Next part is the background. And for those in healthcare, it would be the positive, the pertinent positives or negatives. So what's important to know in this situation? It might be their age, might be a brief history of what's going on, or an allergy, vital signs, anything that might be relevant to the situation that you're describing. The assessment, the next 2 pieces, and the first part is the assessment here, is really going to be focused on your role. So a provider's assessment of a situation using SBAR will be different than front desk, maybe different than nursing staff. Everyone will have a little bit of a different place that they're going with their assessment. So this is going to be your assessment. So based on your assessment of the situation and background, you're going to begin to think through this issue and narrow it down into what your assessment is of what's going on. Next is recommendation. And again, recommendation has everything to do with your role within your organization. So your recommendation may have to do with scheduling appointments, or a test or a procedure or an intervention, or something that may need to happen quickly for a patient. It all depends on what your role is. So think about that as you're walking through this, and we're going to pull this all together here and walk through how to do an effective SBAR. So as we're going through and we're thinking about preparing to use SBAR, I just wanted to walk everybody through this one more time. So assess your situation. So think about what's going on. This is really kind of, you know, just the facts. This is what's happening right now today. And then you're going to be collecting some background information. So you may want to get the health record out or get the health record up on the EHR. You may want to look for some prior information about a patient or a situation that would be helpful. You may need to get additional information from other team members. And then as you're doing this, make sure that you understand what your role is in moving this forward, you know, within the team, particularly for a patient, because we're going to use patient-based scenarios here.
Great. So at this point, we're going to play for you guys 2 quick YouTube videos. Both of these YouTube videos demonstrate ineffective communication, so not utilizing SBAR, and then the second video that we're going to play for you utilizes SBAR. So it's going to be the same scenario, but you're going to be able to see the 2 different communication strategies. And if you haven't already done so, go ahead and in your handouts pane, go ahead and download the SBAR competency checklist. And I want you guys just to kind of be on the lookout for both positive and negative communication strategies that are taking place in each of these videos. So Emily, if you wouldn't mind pulling up the first YouTube video, ineffective communication. Obviously an example of ineffective communication. So at this point we want to take a look at that same exact scenario using the SBAR strategy. Prepared, right? He had everything that he needed in order to communicate the situation, the background, his assessment, and recommendation with the provider. At this point, we want you guys to kind of put all the pieces together, everything that Cheryl and I have talked about, and we want to actually do an SBAR role play activity. So again, if you haven't already done so, please go ahead and download the SBAR checklist in your handouts pane, and we're going to go through a quick activity.
Thank you, Tiffany. And the links for the 2 YouTube videos were embedded, so I would encourage everybody after we're done, because I think it bears going over it, you know, and seeing it again, but do take a look at them. I think there's a lot of SBAR videos out there, but these were some of the best that we found. Okay, so this SBAR, so what we're going to do is just kind of walk through exactly what we would do. We're not necessarily going to use the YouTube scenario. We have a different scenario here, but I just wanted to break it down again for everybody and just review. So the S in SBAR is a 1-sentence description of whatever the need is, and I think in the video he actually identified each piece of it. And if it helps you do SBAR, that's probably a good way for you to deliver an SBAR, to say, the situation is, I have a patient, this is what's going on, and then go to the B, which is then the background information, and in that case was talking about pain scales and, you know, not doing well and possibly going home, and then an assessment. So in this case, in looking at the YouTube video, it would be a focus assessment based on your role. So again, if this information was coming from a floor nurse in the hospital, it may look a little bit different. They may or may not be recommending, changes to medication. But again, based on your role, it's your assessment of what should happen next, and then your recommendation in the R. So now what we're going to do is just that we have a scenario, and this is hopefully one that resonates with people and one that you may have seen before. So we have an older adults at high risk for diabetes care management who's had preventable hospital admissions and transition care. So that's the situation. And so what we have here is we've kind of walked you through a little bit about what's going on here. So we have 72-year-old woman, Mrs. Jones, who's been discharged from the hospital last week after her second admission for complications from diabetes. She's scheduled for her follow-up visit later this week and just called to tell you, and add your role in there to whatever you is, that she is feeling weak, thirsty, and has a persistent headache. And then tells you, they told me when I left the hospital to call you if this happened. So this is what's going on right now. So what I want people to do is, based on what we have given you here, and hopefully if you're able to download that SBAR competency, maybe just jot down, based on what you're looking at here, what you think the situation is. So how do you get this distilled down to one sentence? And then the background of what's going on for Mrs. Jones today. Your assessment, so it's a focus assessment. Again, think about it based on your personal role in whatever it is that you do. And it's going to be different from person to person. And then recommendation. So what is your recommendation as to what we should do at this point? So what I'm going to have people do then is we're going to move on. Oh, no, I'm sorry, not yet. So we're going to stay right here. And what I'd like to do, if there's anybody willing to share in the audience, we'd be interested in hearing your SBAR script. So if you are interested in sharing what your SBAR script would be, please raise your hand and we will unmute you and we will have you share with the group. Talking. Okay. So remember that an SBAR script really is going to be no more than 1 or 2 minutes in delivery. So each of these sections might be a sentence or maybe 2 sentences long, so it's really not a lot. So the key here is having a quick, brief, detailed conversation with a colleague about a specific scenario and your assessment and recommendation on what to do next.
All right, so it looks like we've got Casey. Casey is raising his hand. Emily, would you mind unmuting Casey's line? All right,
I think I'm on. Can you hear me?
Loud and clear.
All right.
So what is your SBAR script, Casey? Well, first of all, tell us who you are and where you come from, and read us your SBAR script.
My name's Casey. I'm in Philadelphia. I apologize. I'm not a clinician. I'm in QI, so I apologize to the clinicians on the call if I'm making things up. But my script, we go something like, I guess I'll just read through it kind of as if I were talking to a colleague. So the situation is Mrs. Jones is on the phone and she's experiencing a persistent headache, feels really weak, and is very thirsty. The background is she's 72 years old. She has uncontrolled diabetes. She was in the hospital last week because of complications associated with the diabetes. She just got out and she's scheduled for her follow-up visit with us later this week. She called us up because she was told at the hospital that she was supposed to contact us if any of this occurred. My assessment is that she may be suffering from hypoglycemia or very low blood sugar, and that this could be a really serious complication. My recommendation is that she should come in for an immediate nursing visit so that we can assess her blood sugar and see if she needs to go to the hospital. Maybe something like that.
Okay, that sounds great. And remember that your assessment and recommendation will always be based on your role within the facility. So we're going to move on then to the next slide. So there we have, and I think it's actually looks pretty close to what we came up with. So we have the situation, again, it's the one sentence. She called in, she says she doesn't feel well. I won't read through the whole thing. We plucked out what we feel are the important details about age, hospitalizations, and then also discharge instructions, as well as some background information of what she said today about how she feels. And then our assessment. So if I was picking up the phone as a nurse practitioner and I saw this and I went through this, my assessment would be that she needs to come in for a visit. And my recommendation would be to find a spot in the schedule, either on my schedule or on, you know, maybe we had some walk-in spots that were opened up so we could get her in today. So I'm hoping what people could see from that, say for instance, if this was different and you were the front desk, so the situation is still the same. Mrs. Jones is still not feeling well. The background is unchanged, that Mrs. Jones, you know, everything we had just said about Mrs. Jones in the background. If I were the person getting this phone call but I was sitting at the front desk, my assessment would be she sounds sick enough that I better have, you know, a nurse or a medical assistant or somebody call her back, and then my recommendation would be to send it on to that person to do the follow-up. So you can see in that situation how, again, based on your role, the S and the A pretty much stay the same because those are the facts. But the assessment and the recommendation have everything to do with what your role may be within the organization. This is not something necessarily that happens real easily for us. I think we have to practice it. That SBAR competency tool actually gives you a way to be able to walk through this so that you can do this together. And I would definitely encourage practicing when you're not in a high-stress situation, maybe at a staff meeting or at another time, so people can get used to doing this.
Okay, so if enhanced communication is something that you and your practice are interested in putting into place within your practice, if it's something that resonates with you, if it's something that you recognize as being a limitation within your practice, you might consider incorporating it into any sort of ongoing quality improvement initiative or quality improvement strategy that your practice has. So again, SBAR is something that can be utilized on the floor. It can also be utilized in communications with HR, in communications with administration. So in order to be able to recognize success, in order to be able to recognize whether or not communication is happening, again, you might think about incorporating it into your ongoing quality improvement initiative. So, for example, you might, in doing so, you would set yourself a goal or an objective. So in this case, an objective might be care teams will demonstrate use of SBAR through a role play activity meeting a minimum score of 80%. You'll notice that this goal is very, very specific, right? You might say that it's SMART. And so for any sort of quality improvement folks in the audience, you know what SMART is, right? SMART is a goal that is specific, it is measurable, it is attainable, it is realistic, and it is time sensitive. So again, if you are looking to incorporate improved or enhanced communication within your practice, we encourage you to actually measure for success and being able to report and demonstrate whether or not that is working. And utilizing an SBAR competency checklist is a great way in order to do that. Cheryl and I provided you guys with an SBAR competency checklist, and just kind of recognizing that every SBAR report is different, right? And so this SBAR competency checklist that we provided you with is pretty comprehensive, and not everything in this checklist needs to report it. Really, we just want to focus on what is needed for your situation, the team communication, any sort of decision making, and anything that is required for documentation. So it's really basic. It's very straightforward. And again, you would set a goal for yourself, and then use this competency checklist accordingly. And then you would just check off which SBAR communication or documentation was completed, noting that there is going to be differences based on the different healthcare team members that are utilizing SBAR. So again, if you're measuring for if enhanced communication is something that is important or something that you feel would benefit your practice, you might also consider kind of taking that extra step and measuring the impact of communication within your practice. So not only measuring the competency of the SBAR strategy or technique, but measuring and recognizing if there are any outcomes or impacts associated with changing communication styles within your practice. So one strategy that you might consider is actually using a survey. And so there is a survey out there called an Interprofessional Collaboration Scale, and it's a really quick, really easy 13-item survey, which doesn't take any more than 3 to 5 minutes to complete. And what this survey does is it assesses team function from the individual team members' perspective. And so it takes a look at things like effectiveness of care team communication. It talks about, or it assesses for things like functioning and accommodation within the care team, and the appearance of isolation within the care team. Again, it's assessed from the individual perspective of the care team member. And so something like this is not necessarily measuring for use of SBAR, but it's measuring for the impact of improved communication. So we talked about how today's is, so earlier on in the presentation, Cheryl and I talked about how today's presentation is grounded in research, and it's grounded in literature. And the literature tells us that there are a number of outcomes associated with improved or enhanced communication. There are patient outcomes you can measure for, outcomes on the team. You can even look at assessing the use of the SBAR strategy as well as communication patterns within your team. So in terms of being able to recognize success, some things that you can be on the lookout for and measure for are you seeing changes in patient engagement? Are you seeing changes in adherence to plans of care? Are you seeing changes in no-show rates? Are you seeing that a greater understanding and commitment of your patients on behalf of their treatment or intervention plans? When you're talking about your care teams themselves, are you seeing a reduction or a change in any sort of medical errors? Is there greater or improved satisfaction within the care team? Again, you can measure for SBAR competency as well as changes in communication patterns within the care team. Okay, so Cheryl and I have provided you guys with a number of resources that can support your practice transformation and practice improvement work. So there are a number of links here that we want you guys just to have at your disposal that will really kind of help and support the dissemination and implementation efforts of what you're doing on staff, on site. So we have here IHI, or the Institute for Healthcare Improvement, has an excellent and very comprehensive SBAR toolkit. In fact, the checklist that you all have downloaded is an adaptation of that one. So you'll notice that the checklist that is included in IHI's SBAR toolkit is unfortunately very physician-centric, and so we've gone ahead and modified it to make it a little bit more clinician neutral. Additionally, we've provided you guys with links to the 2 YouTube videos. This can also help support your implementation efforts if this is something that you want to bring back to your practice and you want to do similar role play activities. We've provided you guys with the links to access those 2 YouTube videos. Additionally, for those of you that may not have been able to view the video during today's presentation, those links are here as well. And lastly, we've provided you guys with two different links to some surveys that are peer review and vetted and have been shown to be resources in being able to measure the impact and outcomes of enhanced teamwork within a primary care and specialty care setting, as well as enhanced collaboration. So at that point, Cheryl and myself, we thank you for your time. We really appreciate everyone sitting in on this call. We hope that you found the information useful. For those of you that maybe work in a primary care association setting, we've included the contact information for our collaborator and colleague, Christine Ganella. Christine is the Director of Training and Technical Assistance. So if SBAR or enhanced team function is something that you want to bring back to your practice, please feel free to reach out to any of us.
So at this point, we'd like to take a few minutes. We have some time in the presentation today for questions. I would also ask people that are listening in on the call today, if you have particular situations of communication in your practice settings that you might like to share with us, either communication gone wrong or gone right. We would love to hear from you. We can unmute your lines and have you share. I think that communication comes in different ways, and we would certainly love to hear both your success stories and maybe some of your challenges, because we know that there are many out there.
We do have a question/comment from Margaret, who noted that the Lunch and Learn, since this Lunch and Learn is being recorded, would it be good to recommend team members listen to this call at a later time? I think yes would be the answer to that.
Yeah, I think that, again, SBAR is not new. It's something I think that's been around for an awfully long time. I have to tell you, I went to my primary care provider's office recently and I saw that people had them on the back of their name badges, but I also noticed no one was looking at them. So this, like anything else, I think it only becomes real when you use it in practice. So I would say yes, have people watch the recorded version of the webinar, and then I would say to practice it, bring it up, talk about it at staff meetings, and then you really just have to try it out. But I would also suggest trying it out in a safe place before you're in the middle of a busy day, like during a staff meeting. As we talked about with communication, it's all about timing and frequency. So the timing needs to be right for your team to hear the message. And maybe it's something you bring up at a staff meeting and say, we're going to talk about communication today. Let's talk about how's it going. How is it going amongst the staff? What does it feel like out there on the day-to-day? Does anybody have any concerns? And then maybe introduce it in that way. But great question. Thanks for asking.
Absolutely. We have another question from someone who said that she works in a post-acute and long-term care setting, and she's an NP. She's attempted to implement the use of SBAR in her facility to no avail, and she's had little administrative buy-in, and she's had some resistance from nursing as well, saying that it's too time-consuming. Are there any suggestions about ways to kind of bring this up again and maybe have some staff buy-in?
The only thing I can tell you on that is people don't like anything that's new. And the one thing that I tell practices, because we've brought this training across the country, is I start by saying, I have something that's going to save you time and money. And I know that's not why we're in this. We don't do this for the time or the money, but I do grab people's information in that way. So depending on the hierarchy where you work, if it's the nursing administration staff or maybe the CNO that you need buy-in, it might be a top-down. So I would actually go beyond your unit and I would actually approach, leadership and talk about this, but really bring it from a standpoint of decreasing medical errors, decreasing, preventable rehospitalizations, improved patient outcomes and improved staff outcomes, as in retention and decreasing turnover. So I think it depends on how you frame it. And I hate to say time and money is what it's all about, but using that approach and then working within your hierarchy to find the best place. You need to find a champion to help you do it because you cannot do this alone. So I totally appreciate what you're saying, but I would not give up. Be the squeaky wheel. You know, you can be the one that makes the change, and I think people will be grateful for you in the end.
Great. There was another comment from Leslie who said that the communication SBAR project that you proposed could be the type of improvement project that a practice could do to help satisfy the CPIA requirement for MIPS. So just something to keep in mind.
Yeah, no, you're absolutely right. So when you're looking, I talked about in those couple first slides about quality improvement programs. This is a quick and simple one that you can do. And yes, you will meet the requirements for MIPS by doing it. So that's also another strong reason to do it. And that might be the little boost that you need to actually make it happen within your facility. And you can do it as a, you know, maybe do it as like a continuation, not a continuing education seminar necessarily with credits, but do it kind of like professional development and do it in a way where it's kind of low key, it's not intense, it's just, hey, you know, let's talk about this. So there's many different ways to do it, but yes, MIPS, and you know, MIPS, while it's being started with Medicare Part B right now, it will eventually, there will be incentive payments for all the commercial insurers, so it's definitely the way of the future.
We have another question here just about using huddles as well. This person sort of identified that huddles have been an issue in the clinic, and so do you have tips about using this particular mode of communication about SBAR in huddles or other huddle tips as well?
Yeah, so I mean, really at the end of the day, when we're talking about enhanced communication, and without knowing anything about this person's practice, but at the end of the day, when we do talk about and refer to enhanced communication, we are talking about not only streamlining communication patterns by way of using SBAR or maybe another method, but use of huddles is another strategy or tool that practices both in primary care and specialty care settings you know, should consider to enhance communication. So using so when using the huddle strategy, definitely incorporating SBAR into that helps kind of streamline huddle efforts, right? So oftentimes a lot of people, you know, when Cheryl and I are out on the road talking about huddles by way of enhancing communication, we get a lot of hems and haws and people are grumbling and saying that, you know, we've tried but it doesn't work. And oftentimes the big complaint that we get is that huddles, while they are designed and ideally supposed to last no more than 10 minutes, they typically drag on for 15, 20, 30 plus minutes, right? And it really eats into your day. And so in doing so, you might consider incorporating SBAR into your huddle, because again, an SBAR is meant to be a short, quick, concise, organized script for delivering information and relaying that information as well as relaying that information to the larger healthcare team. And so definitely incorporating SBAR into your daily huddles is a good consideration and strategy.
Great, thank you, Tiffany. And okay. So again, you know, I'll take this back, rewatch the Vimeo recording. You'll get a link to that when we're done, and you have all of the handouts. So I would definitely, you know, be the champions to make the change that you need to make in your organizations. So just in closing, I wanted to put up information for both Tiffany and myself. We are working as part of the Transforming Clinical Practice Initiative. We do work with nurse practitioners, but all clinicians across the country on many of these issues. So if you have any additional questions either about TCPI or MACRA or any of the things that we've covered, there's our information. I would also, there's a link at the bottom to the AANP. If this whole, alphabet soup of MIPS and MACRA and QPP is something that you don't really know about yet, I would definitely go to the AANP link at the bottom here. There is a tab specifically about MACRA, MIPS, APMs, and a little bit about the QPP. So it's a good place for you to go to kind of get some cursory information about what it is. Collection for MIPS and MACRA has already started in practices as of January of this year and will continue for the next couple of years. So it's definitely things you need to know about. And again, as I said, if you have any other questions or if you would like to join our support and alignment network for updates on all of this, we'd be happy to have you. But your information is right there in order to do that. And then just lastly, to let everybody know, this is, so we do these lunch and learns once or twice a month. And if you do want to sign up for the support and alignment portal, we will send you invites to the different offerings that we have every month. So this one is for next month. We'll be talking about acute pain management in opioid tolerant individuals. We have two doctorally prepared nurse practitioners that will be talking to us about that challenge, both working in a pain center and in primary care and how difficult that is. And if we have no other questions, or if there's, give you one last chance if you wanted to raise your hand. Well, it looks like we have one more question.
Yeah, so someone did ask, Renata asked how frequent you would recommend huddles to be. Should they be start of the day, midday, middle of the day, combination? What sort of is the recommendation?
Thanks. Yeah, Cheryl, you and I might have to consider maybe doing a lunch and learn focusing on huddles. So this question came from Renata. Yes. Yeah, so Renata, that's a great question. And really the answer is it depends. And I know that's vague and doesn't say much, but it really truly does depend. And it depends on your practice and kind of your workflow. I mean, traditionally huddles do take place at the beginning of the day, and that's taking into consideration any sort of pre-visit planning that takes place prior to that. Sometimes pre-visit planning needs to take place at the end of the day, the end of the shift from the day before, right? So that kind of does all your preparatory work, but huddles typically do take place at the beginning of the day. That's not to say that they can't take place at kind of like a midpoint. You know, if you've got like a morning shift and you've got like an afternoon shift, there's something to be said for maybe having like a midday huddle just to kind of catch up the incoming crew on the patients to be seen that afternoon. Additionally, like I said, if you do any sort of afternoon pre-visit planning for the next day, you might consider incorporating huddles at the end of your shift, right, just to kind of lay the groundwork and prepare for the next day. So my answer is it depends. There really is no correct way. There really is no kind of a formula for doing and delivering huddles, and it really just kind of depends on your practice.
The other thing I just wanted to mention that came up in a number of practices who do huddles, they told us that they actually have an online form embedded within their EHR. So when they do their huddles, all of that pre-work has been done, and there's some basic information. Obviously, it has to be something that you're using internally for patient privacy, so that if you have people that come in at different times of the day, which often happens, that they can go to that one place, and whether it's in the EHR or wherever it may reside, but they can go and get caught up on what's going on with the huddle. And that electronic sheet can also be updated throughout the day, so people can check in to see if so-and-so showed up for their flu shot, someone else came in for, a mammogram, and be sure that, they actually got the mammogram ordered. So there are many, many different ways to do that, but the key is just, making sure that it gets done. So we are at the top of the hour. I want to thank you so much for your interest and your attendance today. You will be hearing from Joseph at the AANP if you attended on your ability, and this is only for the live presentation for those of you that are interested in CE credit. And I hope you will join us in the future for our additional webinars and lunch and learns. Thank you, everybody.
Thank you.